Video 2 of the professional counseling skills. It's counseling 5318. I am here with my client Jonah. Hello, Jonah. How was the drive-in?
Long and boring.
Yeah. Houston traffic can be that way. Nothing exciting on the way in?
No.
If you don't mind, go ahead and looking at your professional disclosure statement and agreement, excuse me. So I'm just going to read through a little bit really quickly. It's basically going over the first counseling session that we did, and with that first agreement, same thing, okay? So I am a graduate student working toward the completion of my master's degree in my professional counseling. I'm currently practicing counseling techniques and therefore will be recording our session, but only my professor and classmates will see the tape. So the recording will be destroyed at the end of the semester. Likewise, you should know that there are some limitations to my counseling. Just please note that it is possible to guarantee any specific results regarding your goals. However, together we will work to achieve the best possible results for you. Okay, so I'm going to go over your rights really briefly. It is your right at any time to inquire about the process and procedures being used during our counseling relationship. You have the right to refuse or request changes to any of these suggestions at any time if you are not satisfied. Once you've begun counseling with me, there is no obligation to continue. You have the right to discontinue at any time, though I ask you participate in at least the termination session. My services are rendered in a professional manner, consistent with the ethical standards of the American Counseling Association. If you have a complaint concerning malpractice, this can be reported to my supervisor, who is my professor. Okay. Everything we discuss in the sessions will be kept confidential, except if I determine you're an imminent danger to yourself or others. You report child or elder abuse. Your records are subpoenaed by court of law. You disclose sexual contact with a mental health provider with whom you've had a professional relationship. If information is requested by your contact provider, which would be your insurance company. If I am directed by you in writing to disclose this information to someone of your choosing, and if you bring a malpractice suit against me. You're also aware that this session, again, is being recorded. This recording is for the benefit of the evaluation, and if recorded, will be viewed by the instructor and classmates. This recording will be destroyed upon completion of this course. By your signature below, you're indicating that you have read, understood, and agreed to this agreement. Do you have any questions at this point?
No.
Okay, perfect. And then we'll switch. And today's date is the 6th of November. All right, so go ahead and sign that for me. And then, of course, if you will keep this for your records. Thank you very much. Okay. So we're going to go ahead and dive in. Reiteration of what we went over in the first initial consult when we met. So if you will be kind enough to pull out the NHC assessment and the history information, because I am going to be working off of that. So if you do want to have something to read as well, follow along. Okay. Now, on that first page, we went over the issues that you felt either never applied to you or always applied. Do you see that at the bottom of the first page?
Yeah.
Okay. And so I did make a few notes when we were going over this portion of the history information. And if you'll just briefly look through it for me, remember that 10 was always feeling that you were in that state with those issues, that emotional state. If you'll go through, I went ahead and noted that anger, hostility, and irritability were some things that you did feel emotionally regarding the relationship and the added stress from the family dynamic, which you did express was, issues with your mom and your brother, the medical things going on. So, and then going down to, depression as well, the guilt, PTSD issues, anxiety and nervousness, and tobacco use was high as well with a 10. Um, and then if you'll go to the last column, I did note that we had self-esteem with 8 and stress was high as well with an 8. So with these issues and concerns, and having these issues relating and stemming from, again, the family, we say family drama, but I think it's more than just drama. I think it's the medical, the overall well-being and health of your family unit and how it's affecting you emotionally. Let's see. If you will go to the last packet, it's called mindfulness-based cognitive therapy. So mindfulness-based cognitive therapy, I printed this out for you just to review if you want to follow along with me. But it's a type of therapy that's born from the union of cognitive therapy and meditative principles. And so the basis of it is that we want to combine both cognitive therapy, which aims to help you grow and find relief in symptoms from, your mental health issues through the modification of dysfunctional thinking, and also pairs it with mindfulness, which is summed up as the practice and state of being aware of our thoughts, feelings, emotions, and continuous basis, in the current moment. So self-awareness as well, right? And so the pairing of these two ideas is a powerful therapeutic tool that I feel that can be successfully applied to the treatment of your issues that, have stemmed from the depression, the anxiety, things that you notated in our first session, okay? And so at the bottom, there are a little bit more verbiage if you want to just take that home and kind of read through. That just explains, how does it work? What are the benefits? I want you to go ahead and review that on your own time. So if you'll go to the goal setting packet, in this goal setting packet, I want you to know that as a counselor, it is my job to set clear expectations for the clients. There are many different perceptions of what a counselor can do and what someone can expect from the counseling journey. So I believe that the success of the counseling relationship can only be achieved by setting goals and developing a plan of action to reach those goals. And so with that, it is important for those who truly want to improve their life, which you have noted, that is your reason for coming in, is that you do want to seek that improvement so you can be joy.
Happiness.
Yeah, absolutely. Absolutely. So with setting these goals, it helps the client and counselor remain accountable. It also can provide a better grasp of your growth and the therapy journey. And I just think overall it's beneficial and just applicable to all parts of your life. So some examples are as follows. You can improve the client's ability to establish and maintain relationships. We want to enhance the effectiveness by establishing healthy coping strategies during those times when you are having stressful episodes. Facilitating change behaviors, and that's where I feel that the mindfulness-based cognitive therapy and the cognitive, the bridging of both will be very beneficial with, the issues that you have presented. And so if you'll look at, let's see, the first question, what is it that you want to achieve in the counseling or therapeutic process?
More transparency, more setting boundaries.
Mm-hmm. And setting boundaries, is there a certain relationship that you want to focus on, or is that just overall in general with your family?
My family in general.
Okay.
All of them.
That's fair. And that's fair. Each dynamic is different, and with it being complex, I can see it being, one big puzzle to kind of go at. And what is it that you believe is inhibiting you from achieving that right now? With just looking at it taking a step back and looking at it like a giant puzzle. And, there's so many places to where you can start, but what is it? What is one of the main things that you feel is inhibiting you from achieving, completing that puzzle?
I believe my pursuit to make people happy, just do what makes them happy rather than to look at what it's doing to me affects a lot of it.
Okay. So I could see,
Being a people pleaser.
yeah, there you go. I was gonna say that sounds like what it is. So it's more you're willing to give and give and give rather than, take care of yourself. I get it. I get it. People pleasing. So I would think that would be over self-care. Okay. So what are your expectations? Do you feel that this needs to be addressed in a timely manner because of how it is affecting you?
Yeah.
Yeah.
Yeah. An expectation of setting boundaries and better communication so that I can express the way I feel.
Okay. And what are your motivations for making these changes? I know you say it's because you want to I guess in a way, help you maintain that self-respect for not only, others, but for yourself. But what are some other motivations for making these changes?
To have a better relationship with my family. Not always fighting and arguing and
Just like moving forward, you just want to be able to get out of
yeah,
maybe this place.
yeah, generational curses.
Oh, okay, I like that. And by generational curses, could you expand on that? What do you mean, as far as maybe like education? Like, do you think
But everything, education, just finances, alcohol, tobacco, everything. About everything.
what's the tackle for sure? Now that we've gone over those questions, develop a starting point. As your counselor, it is my duty to help you understand where you are in terms of these goals. So now I would like you to use the GROW acronym to assist us with developing and setting goals. So if you'll pull out, this should be the last packet. It should say G at the top for goal. And I just want you to keep it on the side because I want you to read. Oh, there you go. That's okay. All right. So I'm going to go ahead and break down what the acronym stands for, and then we're going to deep dive into the activity, okay? So, so the G stands for goal. When it comes to setting goals, it's important to hone in on what you really want. So when setting goals, it's a good idea to be more specific rather than general. That way we can fine tune. For example, many people try and set goals that are too general, such as I want to get healthy. So a better idea would be something more like I'm going to improve my diet by eating more organic fresh foods and produce, and I want to accomplish this by June 1st of this year. So that's basically what I want you to do. I want you to set up a realistic, detailed goal that you feel that you can accomplish, you know, through these counseling sessions. So I'm going to ask you a few questions. Let's see, so we can get a little bit more specific. And we kind of went through a little bit of that earlier in the previous packet, so I'm actually going to skip over this really quickly. Let's look at reality. So R stands for reality. As you get further into your goals, it is also imperative to be realistic. I want you to try and ask yourself what is happening in terms of your goal at the present moment. What kind of action have you taken in support of this goal? What kinds of results have you seen thus far? Or if you're struggling with it, you may need to adjust your goal to be more realistic. Okay, so that's always a good adaptability technique. So the moving to O stands for options. And in this portion, I just want you to be mindful of what options have you explored in terms of achieving these goals. What are some of the ways that you can achieve that moving forward? And what have you learned? Okay. And the last would be W, which stands for way forward. So what will you do once you achieve these goals? Be mindful of what kind of obstacles you can envision you might face, how you can plan ahead, come up with some strategies, and then going from there, okay? So, so if you'll go back to the GROW acronym. So one of the goals that you mentioned was implementing boundaries. Let's tackle that first. So if you'll write G, we're going to, and that work? Okay. Setting boundaries. Okay.
Sorry, I'm on low talk for better communication.
No, that's fine. Thank you. I appreciate that. And excuse my voice, I'm under the weather as well.
Yeah, I think everybody is now.
Yes. Yeah. Not very fun. Okay. Okay. So for the goal, I put implementing boundaries, or we can put setting boundaries. Now, I want you to think about your reality. Remember that R stands for reality. So as you get further into your goals of implementing your boundaries with your family, I want you to be realistic, with the dynamic that you guys really have. I mean, you know exactly what it's like to live in that functioning unit. I'm sure you're aware of, what would work, what wouldn't work in order to. Oh, I know. Some of these are a little off the top. I saw that too, and I thought, okay, that's a typo. But just being aware of that family dynamic, try and ask yourself what is happening in terms of your goal at that present moment. Um, what kinds of actions have you taken in support of that goal recently?
Much, honestly.
Yeah.
Just kind of been letting it happen. Uh, Definitely setting boundaries as far as not letting them get to me and mess up my day or my week,
Mm-hmm.
and just cutting communication off when I need to be more healthy for myself.
So, I would say that I would say at first, implementing the boundaries was a little bit difficult for you, but you were able to, even though you struggled with the goal, you were still able to adjust it to where it doesn't really affect you as emotionally since the last time we talked, right?
Absolutely.
Okay. So, with that being said, let's move on to O, which stands for options. So, with what other options have you explored in terms of achieving that goal? You said it was not letting it affect your emotional well being and not letting it ruin your day.
What other options have I implicated?
What are some other ways you can move forward? Do you think, is there anything?
Yeah, being more realistic about the situation and just understanding that I can't please everyone.
Mm, okay.
Putting realistic standards to it so that I'm more accepting of what needs to be done.
And for W, for the way forward, what kind of obstacles do you envision you might face? Can you be more specific as far as giving maybe one example? Let's say, I know you mentioned previously with your mom, it was her medical issues as well with your brother. Their medical issues are not the same, right? So I'm sure it's two different experiences.
My brother's paralyzed and he's very emotional, very depressed. My mom, this is the first time she's really been sick, so it's playing a role in her mental health. So, way forward, honestly, would just I'm trying to do everything I can to get them back home so that they feel more comfortable and work every day towards that, basically.
What do you think? How do you think you would rate your success or the possibility of achievement from a 1 to 10 scale? So, saying, imagine envisioning yourself um, almost like you're in a dream, with envisioning that you are able to maintain just a normal, healthy relationship with your mom and your brother individually, and then as a family unit as well. Um, from number 1 to 10, do you feel that you would be able to have no certainty of achieving that goal, being number 1, or 10, meaning you have 100% certainty that you would achieve that
I like to think 7 or 8 because I'll
goal?
always have communication with them, but I'm also not gonna let them destroy my mental health at the same time anymore.
Right, right. That's fair. That's fair. Okay.
And I know there's gonna be pushback from them.
Right, right. No, absolutely. Absolutely. Okay. All right. And now I did provide an extra page on the back because I did want to ask, now that we went over what we had in the original initial consult, was there anything going on that maybe you wanted to bring up that has happened since then between maybe you and mom or Josh?
Not really. I mean, she finally was placed in a home, but it's a temporary place, and it really only created more problems because she just doesn't want to deal with the fact that she needs help.
Yeah. Yeah. So it's an adjustment, I think, all the way around. I think it is. I think it is. You think that's something maybe you want to talk about a little bit more in the next session? Okay. Yeah, we don't have to right now. Okay. All right. So let's see. I'm going to pull out the mindfulness-based cognitive therapy pathway. I do have a little bit of homework for you. So remember, I gave you some verbiage to kind of go through at home in case you want to go over any points that we talked about during our discussion today. If you'll go to the second page. What I do want to do for homework that I think will be very beneficial for those moments of stress because from what I can remember that we discussed in the first session, you mentioned that you and mom and Josh really only talk on the phone or through text, and there's not that physical interaction because they live in Kentucky. So I can see how easy it is to get worked up and having those stressful conversations and how we discussed that before. So I want to implement what's called the 3-minute breathing space. So this is part of the mindfulness-based cognitive therapy technique that I think might be able to help us. So in this quick exercise, it's undertaken in 3 steps. So the first minute is spent on answering the question. So in those moments of heated discussions or stressful discussions with mom, Josh, or both at the same time, I want you to be able to, in the minute, answer the question in your mind, how am I doing right now? And just being self-aware of where you are in the present moment during that time. And I know it's hard for you to take a moment and breathe in the interaction because I'm sure if it's heated, you're going to be going back and forth. But even if it's just being self-aware in the moment, if you can do that for me, once the interaction is done and you get off the phone, do the 3-minute breathing exercise. And I want you to think to yourself in that first minute of the 3-minute breathing exercise, how am I doing right now? While focusing on your feelings, thoughts, and sensations that are arising and trying to assign those words and phrases. So, again, just putting thought to an emotion. Okay. The second minute is spent on keeping awareness on your breath. So I want you to just be aware of in the moment, if you're just having that heated discussion, are you breathing in rapidly? Are you huffing and puffing? Are you just trying to woosah it out? Just again, being aware of your breathing and where it is taking you in that moment. And then the last minute is used for the expansion of your attention, for solely focusing on the breath, to feeling physical sensations and how they affect the rest of the body. Because I do believe that the body does keep the score when it comes to stress, when it comes to these extra stressors in your life. And so even if you're just slowly becoming aware of when these stressful moments are happening and they're evoking these responses out of you, it's more than emotional, it becomes physical. And then that's when it becomes more of a toll on ourselves because then we get sick. And then, and it happens. So again, know the family dynamic and the issues with mom, Josh, and then both of them together as a unit can be overwhelming. And it looks like just this huge puzzle that you are not really sure where to start to pick the pieces to straighten out. And it is. This is a great way to start to build a foundation to where you are not only honoring yourself, but you're implementing self respect because you are creating those boundaries. You're being mindful of what it's doing to you so that now going forward, that mindfulness will be in the conversations or in the back of your mind during those heated exchanges and those conversations. Okay. And so, with that being said, if you can do this for me within the next week or two, and I do ask one small thing. When you do have these exchanges, I want you to note it in your phone, even if it's in a text or in your little notes. Or if you want to journal, it's up to you. But I would like you to go ahead and do that for me. That way we can discuss it at the next session and we'll go from there. And of course, if you have anything else that you would like to bring up, just notify me at the beginning of it. All right. Well, thank you very much. I appreciate your time. Thank you for doing this session, even though I'm a little ill. I appreciate it. All right. Well, thank you so much.